All right. Good afternoon, everyone. How's everyone doing? Good afternoon, everyone.
Good afternoon. I'm doing well.
Good
Okay,
afternoon.
okay. Okay,
Good
okay. I'm
afternoon.
glad we're all here. Um, welcome to the one second. Okay, so welcome to the entrepreneurial journey. I appreciate for everyone who's been rocking with us so far. This is volume 5. Um, this definitely has been a learning experience for myself. Putting all this together, and I've been hearing a lot of great reviews as far as the webinars, and we always post them on our YouTube page. So hopefully at the end of this conversation, I can post that YouTube link so you guys can see all of our other webinars. Um, but yeah, so I will begin. I think people are starting to come in. But I want to start off by introducing myself. And then I would like to ask Sean Chrysostom, who's one of our small business coaches here, to kind of introduce BCL, what it is that we do. Sean has gained some popularity in the last couple of months with some of the programs that we've been offering. So some of you may remember him. But my name is Atsuko St. Louis. I'm the technical assistant here at BCL. I basically work within our technical assistance department and run a few of our outreach programs here. So without further ado, Sean, if you can give them a little overview of BCL, our services, and then we'll move forward.
Sure. Thank you, Suko. My name is Sean Chrysostom. I am the TA officer here, small business coach at BCL. Baltimore Community Lending. We are a CDFI, a community development financial institution based here in Baltimore City. In fact, we just moved into our new location on Calvert Street here in Baltimore. We work with individuals, both small businesses and real estate individuals. We have a real estate component that works with small developers looking to build their business. BCL was founded in 1989 to help the communities in Baltimore. We've now expanded to the 5 surrounding counties as well. But it's really to help those individuals who are business owners, small businesses, and real estate developers who aren't bankable. They aren't able to get bank financing. They aren't able to go to a traditional institution. We offer a number of services, TA service and working to help them pull together the packages. But we also offer underwriting that's a little different than your traditional bank or credit union. One of the things, particularly on the small business side, is we're not credit driven. It doesn't mean we don't look at credit, but we don't make it the final deciding factor. We look at the strength of the business plan. We look at the individual and other things as well. As we've grown at BCL, we continue to impact communities, doing various outreach events, our Coffee with Capital event that we hold throughout the city. And it's a great way for us to educate small businesses about not only the services we offer, but the ways that we can help them grow and build themselves. And the whole goal of BCL is to be a mission-driven organization that helps individual businesses grow and thrive. We believe that once businesses grow and thrive, the city around it will grow and thrive by hiring more individuals, by expanding and offering services. So BCL is continuing our mission, as we said, and now that we've expanded to have a business development resource center here at our Calvert Street location that's going to reach out and do even more. We're offering free small business services, free lending clinics, and so forth. So check us out at bclending.org to find out more about what we do. But here we're continuing to strive to be a mission-driven lender, serving the community, helping individuals who may not be able to, at this point, get a bank loan to expand their business, to thrive and grow. And that's what we continue to do. And this seminar is just an extension of what we are committed to do here at BCL to help individuals in Baltimore and the surrounding communities. With that, I'm going to turn it back over to Suko to take it from here.
Thank you, Sean. I appreciate you. So starting and scaling a behavioral health business, appreciate any therapist, anyone who's actually in this field. I actually just had my first ever therapy session yesterday. And it really was amazing. I feel like it was what I thought it was gonna be and a little bit more. So I appreciate everyone and your services. So let's move forward. Today, our agenda is going to be first, I want to start off by introducing Initiate Prosperity. That is um, our third-party educational platform. So we'll be going over that. And after this call, I'll be sending you guys a resource guide to give you all access to it. Our presenter today, Vanessa Day, who I'll be introducing shortly, will be going over all things related to licensing, Medicaid, Medicare. That's really been a whole situation, so I'm glad we'll be touching on that topic and focusing on compliance. And I've looked over her presentation. I think you guys are definitely in for a treat, for sure. Okay, so what is Initiate Prosperity? I'll be going over the platform briefly. So Initiate Prosperity is our educational platform. It is sectioned off into four categories. You can learn things as far as startups, money management, um, uh, marketing, and even management as far as understanding how to hire, how to retain people. There's a few different like training modules on here. They have different video resources, calculators, guides, and my favorite are the templates. And I think as a small business owner, whether you started or you're going, things like these can become expensive. I know how much we pay for this. So this is a free platform for you guys. And as I mentioned, I'll be giving everyone here access to it later. Last but not least, just want to introduce Vanessa. Vanessa is CEO of Foxx Chubby Health Policy Consulting, which is a Maryland-based consulting firm committed to promoting access to high-quality community-based mental health services for people in historically underserved communities. So I just want to open up the floor for Vanessa to introduce herself, and then just give her the mic just to start her presentation.
Good afternoon. Thank you for having me, Suko. I really appreciate it.
Mhm.
And I just want to give a quick plug for BCL. When I first talked to, well, primarily Suko, but also BCL, when I first talked to Suko about what I wanted to do with my business, as a small business owner, you have those days when you're just like, man, I quit. But I kind of got new fire after talking to Suko. I was like, wait a minute, he might have believed in me a little bit more than I believed in myself. And so it was pretty exciting to talk to him. And so if you have not taken advantage of the services at BCL, primarily reached out to the people and tapped in, I greatly encourage it. My name is Vanessa Day. I am born and raised here in Baltimore City, and I am the principal at Foxx Chubby Health Policy Consulting. We have a simple mission. We partner with organizations doing work we believe in for people we care about. Um, we have been, I think we started in 2018, but officially we have been in this structure since 2020. And if you could go to the slides to go, I don't know, I can't see my slides, but you might already have them up there.
I can share it for
Oh, do
you,
you want me
or
to
I
share?
can give
Oh, I
you,
can share.
yeah, I can give you access to share.
Okay.
No problem.
All righty. Sorry about that. Let me get them up there. And then
Or I have it, so whatever works best. If
no,
if you want
I
me
got
to, I could do that too.
I did not listen. I'm all good with being in charge. I just didn't know I was getting to be in charge. So now that I
I got
know,
you. I
let
got
me let me go
you.
ahead and get that started. Let me
Um,
share my slides. There we go. Okay. All righty. So this is us. We started just with a commercial. Can you see? Yeah, just this is us.
Yeah.
We started with just a commercial practice where we helped organizations, community-based mental health organizations, uh, get started, stay compliant, doing education for owners, and ultimately helping owners understand how to integrate quality and compliance so that their services can get and remain supportive to the communities that we serve. Since we started, we've grown to 2 new practice areas. So we also have an associate's practice where we do government health program consulting, systems evaluation, and healthcare strategy on a broader level. So we work with larger organizations, national organizations, international organizations, adding our expertise to their practices. And then we have an Innova practice, which is our newest area of business, where it is essentially our behavioral health lab, where we work with licensed clinicians to implement different strategies, test our strategies and technology to ensure that what we're putting out works, help develop new models, new payment models, and connect with new community partners, just all toward the same mission of ensuring that people and communities that really deserve it get the information, get the care that they deserve in a quality manner. So today's learning objectives, we're going to map the key steps required to licensing a community-based mental health organization here in Maryland. It's going to be an interesting chat. I look forward to us in the questions and answers. We're going to talk about the Medicaid and Medicare landscape. And I think probably more broadly, talk about the changes in the way government is impacting our work directly. And then we're going to talk about HIPAA. So thinking about some changes to the current HIPAA strategy. We're going to look at some privacy and security risks, just some real fundamental things that you can do to keep your clients' information, but then also your organizational information safe. So let me get right to it. Before we get into the rest of the presentation, I do want to say that coming to this work is more a calling than anything else, no matter how you get here, right? So I know that in the industry, there are a lot of individuals who come to it because they understand the business opportunity, but then there are other individuals who are clinical and they come to it because they have a heart for the work. I believe that there's a space for all of those individuals in this. And I will stand on the idea that if you operate a business like this, if you come to this practice with the understanding that you really are responsible for the lives that you touch, like integrating compliance and quality, just as your general practice and standard, this business can reward you greatly. You can build a sustainable business, a business that is financially sound, that will support you into growing and changing the fundamental way that you approach your community work. So that being said, let me get licensing and permitting what you need to know. So the 3 words I hate to hear from anybody giving any kind of compliance or any kind of advice on getting started in this business is all you need. If someone tells you that, please run, because there's often, it's very, very rare that you're in this position where there's really all you need. So what we're going to talk about is educating ourselves as owners and leadership in this space to understand what you really need and how you move forward from a licensing perspective. So we're going to start at the beginning. Who regulates us? Looking at the current structure of Maryland's licensing, and then the steps to apply and really how to prepare yourself so that no matter the shifts that you see, you're able to navigate those shifts and be ready to provide the information so that you can expedite your process as much as possible. So this graphic is really it's kind of a comprehensive, but high level overview of the regulatory agencies that really dictate the work, behavioral health work here in our state. So at the top, we have the U.S. Department of Health and Human Services. That's your federal government partner. Agencies that exist are CMS, That's the Centers for Medicare and Medicaid Services, the largest payer for health insurance in the country. There's SAMHSA. I'm gonna forget all the words of the acronym, but that's essentially the organization that puts out all of your kind of alcohol and drug abuse related policy. There's HRSA, there's the CDC, and then there's the OIG. It's not fair to put the OIG in red because you know that there's a certain connotation to it. Go ahead, I'm sorry.
Sorry to interrupt. Is there a way that you can like make the screen a little wider or make it in
Can you
presentation
not?
mode?
Oh, sure. I thought you
I,
were seeing my presentation mode. A second.
um,
Uh, Let me see what I'm sharing. Oh, okay.
Dawn, are you able to see, or is it just me? Because I think
How about that?
okay. Okay, now yeah, that's much better.
Okay, good deal. Sorry
Thank
about that.
I appreciate it.
I was all into it. Okay, so CMS is our main regulatory body. If you pay attention to CMS, you'll know what's coming, what's happening, where the priorities are, where the funding is. CMS, like I said, is the largest payer. They put out the policy, and honestly, as CMS goes, so does most of the other payers. The Office of the Inspector General is important because that's the office that governs your compliance. They look at your fraud, waste, and abuse. They dictate what largely what states are going to be tracking in terms of auditing and so forth. And they're very transparent. So they put out ahead of time, like about a year or two ahead of time, where they're going to be focusing their efforts. So the recent news that you've seen about 3.1s that have being audited and there being problems with 3.1s. Well, OIG a couple years ago put out in their work plan that they would be auditing 3.1s across the country. And so that audit strategy trickles down to the states because states start looking at what OIG is going to look at, and then you start finding what's behind what's in the sausage once you start looking at it. The Centers for Medicare and Medicaid Services, like I said, they provide the policy on the federal level for Medicare and Medicaid. Now, Medicare, they cover your disabled 65 and under, your ESRD. I'm sorry, they cover your disabled 65 and under, but then your 65 and over have Medicare, and they also cover individuals with ALS. On Medicaid side, we're looking at low income individuals, disabled individuals, and others based on the eligibility requirements in the state funding program. So the interesting thing about Medicaid is that Medicaid is a state and federal partnership. So Medicare is all administered by CMS, all out of the federal government. Medicaid, though, is regulated by CMS, administered by the states. Essentially, what that means is that CMS sets broad Medicaid policy, and states have a lot of flexibility under that Medicaid policy to kind of design different things. So for instance, how far their enrollment can reach in terms of who can, what poverty level access there is. States can decide within the realms of what CMS allows, what benefits they cover, and how they cover those benefits. So our state Medicaid program is operated under the Maryland Department of Health. Oh, let me make one important point. The funding for Medicaid is joint between states and the federal government. So on average, I'll say on average, some states have a higher rate, but on average, for every dollar that a state puts out, the federal Medicaid program will reimburse half of that dollar, so 50 cents. So it's a partnership, 50-50 partnership. That is why this piece is important. Okay, so every state has a federal Medicaid program. Ours is under the Medicaid Department of Health. Our Medicaid program, our public insurance program in the state of Maryland, Medicaid, is under the Department of Public Health and is separate from our Behavioral Health Administration. That is very important because Medicaid is a payer, like Blue Cross and Blue Shield, but Behavioral Health Administration actually oversees the behavioral health regulatory space, the licensing, the requirements for accreditation. So that is often a conversation that we have with folks. Those are two separate agencies under the Maryland Department of Health. And that can be a bit of a problem because one of the issues that the administration is looking to rectify is that the policies don't align. So Medicaid might have one set of policies or one group of individuals who can provide a service, but the Behavioral Health Administration might have a slightly different policy, and that can be problematic for individuals trying to operate a business. And then I'm going to move us into my next slide so we can go ahead and, all right. So these are some community partners, industry partners, and essential government organizations outside of those regulatory bodies that also impact our work. And these two slides are really important because when you get into this work, you really are accountable to these different partners, these different organizations. So that's why it's important to at least know where they are. Let me get started on that. So business development agencies, so of course your IRS, your Maryland Department of Taxation and Assessments, OSHA, your labor laws, all that. You're running a business, you are accountable to those individuals or to those individual agencies. In the behavioral health world, you are accountable to your local behavioral health authority. So if you're in Baltimore City, Baltimore County, whatever jurisdiction under the Behavioral Health Administration, because of the way that our system is structured, you are accountable to your local jurisdiction. You're accountable to your accrediting bodies. So CARF, Joint Commission, COA, ACHC. If you have a justice involved program, you're accountable to NCCHC. And I have a link to all these acronyms at the end of my presentation. And then you also are accountable within those accrediting bodies to the different standards, evidence-based practices, any kind of quality priorities or industry information, all of which you should get from your accrediting bodies. You are accountable to your jurisdiction zoning and permitting offices. So your occupancy and use, your building safety and inspection, any kind of construction permitting. Your fire department, so fire inspection, fire safety, emergency management, any kind of professional licensing boards. So your staff, if you have, you will have clinicians on your staff. So you're accountable to ensuring that they are operating under appropriate licenses, the appropriate scope of practice, any kind of supervision requirements, or professional standards and expectations. So for instance, when you look in the rules and you see, a rehab specialist for a psychiatric rehabilitation program is supposed to do A, B, and C. Oftentimes, those requirements come directly from the licensing requirements. For licensing requirements for your clinicians. You are also responsible to your community stakeholders. So gathering input on those services actually needed in the community. Looking at community resources that you actually can connect to and use to build and support your program. So ensuring that your organization's reputation is one of quality and something that your community stakeholders can support. And then the importance of partnership and collaboration, not only with your partner organizations that provide behavioral health, but also with individuals in the community. And then your partner organization resources, so your provider networks and partnerships, ensuring that oftentimes ensuring that you do have these relationships with partner organizations really supports your continuity of care. So being able to do a warm handoff to a partner organization or a therapist, maintaining connection with your client's provider team, all of that stuff, it goes into it, and you're responsible to as part of this work. And then also creating community awareness and addressing stigma. One organization that is not on here and is kind of deeply important in all of this is when you are working with substance use disorder programs, the American Society of Addictions Medicine, ASAM, is a key partner. Our rules in Maryland point directly to ASAM requirements for some of our operational requirements. So it's important to consider that ASAM should be on this list as well. All righty, to the licensing process. Your eyes do not fool you. This is really like, this is what your licensing process should look like. This little box down at the on the right-hand side is pulled directly from the BHA website. It walks you through, just, you know, plainly through everything you need to do in order to become licensed. The issue is, though, that it doesn't get into the nuance of how your accreditation timeframe might not align with your licensing timeframe. It doesn't talk about how there's a preliminary licensing process that you need to go through before you do the final licensing process. And so this breakdown that I provide here walks you through pre-licensing, your preliminary licensing, and your full licensing. The most important piece of information on this slide is the pre-licensing piece. Before you get into any kind of licensing, you'll need to go through this, about 12 or 15 bullets on the side. So all important: selecting the right business structure. Are you a not-for-profit? Tax-wise, are making sure that you have the right protections. You're an LLC or you need to be a corporation. All of those kinds of foundational business questions are of uber importance here. Identifying needed services. Well, I'll give you a practical example. I live in Hamilton. On my way home, I drive up Bel Air Road, and in 3 blocks, there are 8 community-based mental health organizations. Well, do we need 8, right? Does the community look like we have 8 functioning, high-quality organizations? No. And so identifying what services are needed. If you have your pulse on this at all, you know that we right now are in a moratorium in Baltimore City for psychiatric rehabilitation services, for intensive outpatient services, and PHP services. Well, the reason why is because we really do have so many providers who are providing those services, and we honestly aren't seeing the results that we should be seeing. And so when you get started in this work, reach out to your local behavioral health organization. Talk to your resources in the community. Talk to individuals in the state. Understand what the services really are that are needed across the state. Someone will tell you if you ask, right? And it'll be impactful to you, because you don't want to build a business in a saturated market and have to unnecessarily fight for clients. You want to understand your own service and operational capability. You're going to understand your capacity and also your know-how. True story. I know a gentleman who is an electrician. He was doing electrician by trade. He was at an organization offering PRP services, and someone said, "Oh, you should do this. You can make a lot of money at it." So he started about the business of starting a PRP. No clinical background, no understanding of the intensity of the service, the requirement, and it was a struggle for him. I mean, he eventually got it done. I did not participate with him. He eventually got it done, but it was a big struggle because it is impactful to somebody. This is the best way I can say it is someone who is getting PRP services, they need a life one-on-one, right? To do basic things. And so if you know nothing about the level of service needed, but you go into this work not really understanding your own capacity, you're doing the community a disservice and you're doing yourself a disservice. Develop a business plan. This is a business, you want it to last and you want it to be sustainable, right? Develop a business plan. In fact, it is required as part of the licensing process now. You want to create a financial plan with projections. Over the course of 6 months with state licensing changes, really a process that used to take 9 to 12 months now takes 1.5 to 2 years. You want to make sure you have the right financial plan in place for that. You want to look at what accrediting body works best for you. That could include a number of factors: time, money, the requirements that they have, whether there are differences. They kind of have personalities. So CARF is more mentorship based, where more mentorship based and more like upfront business building, where Joint Commission is a little more safety, punitive kind of focused. You want to look at engaging your community, because someone will tell you what has worked and what looks good in the community and what doesn't. You want to secure the right location. For instance, you need to understand what it means to have a storefront versus having a residential property. You want to make sure that the property you select is safe. It can pass a fire inspection. It can pass an occupancy and use inspection. I have had people lease properties have a hard time getting out of leases after they find out that the landlord did work but never pulled the proper permits. So somebody else's workaround becomes your financial problem because you're trying to figure out how to get out of this lease, run your program, and all the time you're paying rent, right? Food and safety inspections, like, is the kitchen up to par? You want to develop your policies and procedures. And I just talked to a young woman who was starting an organization yesterday, and she said, "Oh, well, I just plugged all my standards into ChatGPT and they gave me a book of policies and procedures." Well, nope. You can have ChatGPT will give you a great book of policies and procedures, but guess what? You need to know how to implement them. You need to know the standards. You need to know what you are agreeing to. That is no more effective than you hiring me and me giving you a set of policies and procedures, and you never bother to look at them. You never bother to make sure that they actually match what you do. And it might save you money initially, but on the back end, when one of those organizations that were on the first couple slides comes in to look at your work and they determine, well, hold on, you don't have the right staff, or you say that you do your safety this way but not that way, it's going to cost you money. So develop your policies and procedures. I'm not saying don't use a template. I'm not saying don't use ChatGPT. I'm saying you be the expert on how your business is running, how your business is organized. You need to secure the required and necessary staff. I know the letters is like alphabet soup when you're like, should I have an LCSWC and who needs a supervisor? You can always reach out to the licensing boards for that to get that information. You want to verify their credentials. I know it's a big hassle, but spend the $14 to sign up with one of those clearance houses that verifies degrees. It'll save you some money, because if Medicaid does an audit and finds out that your clinician wasn't properly licensed or didn't have the background, it doesn't matter to them. They can ask for their money back, and sometimes they do, and they do it with interest. So all this stuff saves you money. You also want to do your seclusions checks. exclusions checks. It's free. Go to the LEIE, look at those exclusions, set up a SAM account, make sure that the people that you are hiring actually have not been excluded from participating in government health programs. And then ensure the health and safety and privacy elements are in place. You want to walk through, you want to make sure that the places that you are asking people to live and work in are places that you will want to live and work in, and so forth. So all of these things, other things, you know, basic things that you do when you start a business, all of these things pre-licensing are what you need to make sure you have set before you get into your licensing phase, and it will help you in the long run. The licensing phase actually is just paperwork. So you do your preliminary licensing, it's your survey prep, your accreditation, your agreement to cooperate, your preliminary license, right? The time frame really for this could take 6, 9, 12 months. You really have a little bit more say in how this looks initially. The issue comes in when you are waiting for your license to come back from BHA right now. Right now, we're kind of looking at about a year, 9 months to a year. Now, there have been some changes, maybe some improvements, but right now, it's taking a long time to get a license, which delays getting your full license and your opportunity to really fully operate, because you can't operate with a license. So again, back to creating that financial plan, looking at the projections, talking to people to really understand like how long the licensing process is going to take. And then the final piece is just the full license. Depending on your accreditation organization, you know, you will go through a second survey. The way that it looks is you do your preliminary licensing, you operate for 6 months to a year. Your accreditation organization comes back and looks at your organization to say, what have you been doing over this year? How have you implemented these standards over the year, right? When they come out for your full licensing, they'll be looking at your operations, your staff. They will do a full run through of your organization to understand exactly, not just like whether you are ready, right? Not a readiness review, but your actual implementation. If you did not document it, it did not happen. So keep that in mind, because they will be looking for your documentation. If you move forward like you're supposed to, and you can document that you've been operating in your time frame in a way that is compliant or highly compliant with the standards, then you should get a 3-year license. If not, I think the others are 1-year provisional, and then there's some that you can get like just 6 months, depending on the organization. But at a high level, that's the licensing process. And then navigating the current regulatory and system challenges across programs and agencies. So I'm going to take a second and just frame this a little bit. Right now, we are in a space where our government overall, on multiple levels, is really shifting the way they interact with systems, right? So we really are moving towards a more fraud, waste, and abuse focused type government, fraud, waste, and abuse focused government in this space. And so as we consider the changes, as we consider the environment that we've been existing in and the changes that we've seen coming down the pipe, integrating your compliance and your quality into your everyday operations is becoming more and more paramount, because the way to protect yourself, your business, your clients, is to know what the requirements are and do your best to meet them. No organization is perfect. That's why they call it continuous improvement. But at least being at a space where you understand what the standard is and you're doing your best to meet it. And I tell my clients sometimes, like, you're doing your best to meet it, and if you have to, because sometimes we have to prioritize. So either you're doing your best to meet it, or you understand what it is, so that when you have to navigate around something, you are fully aware of how you create those strategies as well. However, you need to be creative, right? So our national changes. So changes to enrollment and funding priorities. I think over the last month, well, maybe 2 months, have seen Medicaid, our state payer, come out with information about how changes at the federal level are impacting or may impact federal Medicaid. Two major things have been pointed out: work requirements and more frequent enrollment checks. These two strategies are ways to get people off of the Medicaid rolls. They are proven methods for doing that. So, if you have folks who are dealing with a lot of other like social determinants of health, like they don't have stable housing, they're not really eating, and they have mental health issues, or all kinds of stuff. It is hard to get somebody to keep coming into an office to make sure they have anything, right? So coming back repeatedly to get help, to make sure their health insurance is enrolled, is difficult for people. I mean, even transportation, taking off work, all of that, it makes it difficult. And then the work requirement piece of it, well, that's administratively difficult. I don't know if I'll speak from my own experience. In the transition between jobs once, I got unemployment. Well, every week on unemployment, you have to go in and certify, like, oh, I did all of these job searches. That was the hardest thing I ever had to do. Like, just remember the administrative burden of remembering to go in and put in that information was just so difficult. And so that's what the idea is. If we make it difficult, then we can move people off the rolls and thereby save money. So as a community-based mental health provider who honestly will be largely funded by Medicaid or a large part of the public behavioral health system, it is incumbent upon you really to make sure you're doing those checks with your clients, make sure that their eligibility or their enrollment is up to date. If you're doing PRP work or any kind of work, honestly, any kind of case management, making sure that the entitlements are in place. That is a priority essentially that's being highlighted as part of this work. So changes in the focus and implementation, and then increased monitoring and auditing, fiscal integrity, and also hopefully quality measures being added to the mix, but definitely increased monitoring and auditing. One way to dial back the cost of providing care is to look at money that collectively we put out the door as a state or across the country for fraudulent practices, and fraudulent has a broad meaning here, but taking money back that we put out and we didn't need to. That's on the table. That's more on the table now. So in our state, we are facing some changes to our system overall. For a long time, honestly, we have operated in a low accountability framework. So from the state level on down through providers, we really have been kind of just like, let us cast a wide net so we can make sure that people are receiving services, and we'll deal with the rest later. Well, that has cost us because we haven't necessarily focused on quality. We haven't necessarily regulated the way that we needed to. And so now we're in a position of having to reconcile that. So we do have ongoing changes in regulation. And the interesting thing about the proposed regs that just came out in, I think, July, that were then put on pause by a state legislature, is that they largely just kind of lay out what was already required, right? They are just kind of a reiteration of what we all as a community should have been doing, but then also what the state should have been requiring. So there's that. There's communication. Says there's a challenge in our state of communication. So a lot of times things will happen, but they don't get fed down to the provider community, or the provider community doesn't know the right places to go reach out. Their physical system changes. It should more IT changes. So there's a new licensing portal that has just come out. We have a new administrative services organization who's handling the payments, and they're kind of getting to their groove. People are having a lot of delays in payment. There's ongoing licensing delays as the agency, Behavioral Health Administration, is trying to get its arm around who's licensed, what the services are that we're providing, what they look like across the state. They have delayed the licensing process. There's a lack of clarity historically, over the last 2 years, it's kind of been a lack of clarity and consistency. So as they are getting their arms around understanding what the environment looks like, it's like they're kind of making real-time changes, which has made it difficult for providers to understand what the requirements are, right? And there's really some shared accountability that is not there, that we are facing as a community. So we have providers saying, well, I thought it was this, and then the state saying, but no, it's this, and nobody really taking accountability to like what our real point is in serving our clients. So the keys to navigating, I feel like I'm rushing a little bit, but I want to get us through it. Keys to navigating these challenges. Like I said before, understanding the requirements. You can't know everything, but you can know what you need to know, right? Like you can know your fundamentals, and you can build a solid team around you so that you have your bases covered. Again, not perfection, continuous improvement. You want to plan for extended time frames. If you started your journey understanding you needed $50,000 in startup costs, you need to plan out for more, and be creative in that. Creating your budget, forecast, and managing your costs, integrating compliance and quality. Don't have your policies and procedures work like something that's sitting on top of your program, right? You want to integrate your compliance and quality operations into your work. And pro tip, your policies and procedures, if you follow your standards, they really are designed to help you integrate everything into your operations. Even if you don't use CARF as your accrediting body, that first Aspire to Excellence is a gold mine. If you follow Aspire to Excellence and you integrate those standards into your work, you will be halfway there in making sure that your operations are moving smoothly. Engaging in continuous improvement, communicating with your staff, making sure you are paying attention to the things you do well, the things you need to improve. Again, continuous improvement. If you get an audit, it's always great to be in a situation where you can say, oh yeah, we know that we did that, and here's how we fixed it. Auditors love to see that. And then hiring reputable professionals. Our clinicians are in high demand. Sometimes they're tired, they got 15 jobs, they're trying to manage everything, and they really do have a heart for the work. You have to find somebody that works for your program and can do the things that you need them to do. You want the LCSWC who says, I really want to work for you, but I can't give you 20 hours. You have to find, you want that person. You want the person that says, oh, I have to be here, or I can't sign off on that, because you want that person who is true to their own license, right? And so work on hiring good staff. Stay connected to your source of truth information. At the end of this presentation, there's a slide. It has about 7 links of information. I always include source of truth information in any work that we do out of my company, because an educated leadership is the best possible operating strategy. And then advocating. Show up to the meetings, show up to the community listening sessions, go talk to your state rep, talk to the folks in the city who are dialed into this work, or the county. Advocate for yourself and your clients. People setting policy, I have been a regulator. People setting policy they don't know really what your life looks like as a clinician, right? They don't really understand, and you can see it in the disjointedness in the way policy works. So for instance, in the OIG, they put out regulations about how you can support individuals in getting to services. Like you can't give them a certain amount of money, right? But you serve a population where they can't get back and forth to, like, you literally can't help them because they don't have transportation. So the first inclination of an owner is, well, can I buy them a bus pass? Well, you got to be careful because OIG says you risk a fraud, waste, and abuse violation if you give them more than I think it's $75 a year, something like that. Well, that's crazy, right? Like operationally, those things don't align. So it is imperative that you add voice to these policy decisions. And then where are the opportunities? Integrating compliance and quality. I can beat that dead horse. Well, I can beat that horse. It's alive for forever. But paying attention to what's going on above you in those agencies. You don't have to wait for BHA to tell you. You can look at what's happening at CMS. CMS puts out newsletters. They identify where their funding focus is. You can look at SAMHSA. You can see what grants they're funding. You can look at HRSA's website and understand what kind of grants they're funding, where their focus is. Identifying your payer priorities. So what's BHA talking about? Well, what's Medicaid talking about? What's BHA talking about? And then leveraging statewide data. You have access to data. You can get it from your local behavioral health authority. You can also get it from BHA. They will gladly give it to you. Go to conferences. Don't just go to your local conference, but go to some of the national conferences. Go to some of these policy conferences where they're talking about Medicaid. Get that understanding, make those connections, because that will help you understand where you are, but it also help you grow your business. And then when regulations come out, read them, comment on them, add your voice to them, make it a point to call, go in. Every regulation that comes out, you have the opportunity to send in comments. What we do in our company is, because we know sometimes people are uncomfortable with communicating directly with government because it's like, you don't want it to be a gotcha. We collect comments. We do two things. We have sessions where we actually go through line by line and talk about the changes, and then we collect comments and send them into BHA. You can reach out to us. We will happily send in your comments, but please participate because it impacts your work. Okay. Protecting your practice and clients' HIPAA privacy requirements. So HIPAA, even since this slide presentation was created, there's been new information that came out about from the White House, an executive order that makes some changes to how information can flow between providers and also how individuals can have access to their own information. So that hasn't been fully fleshed out just yet. But there's deregulation in process that adjusts the federal HIPAA standard. I can't speak to it fully right now, so I won't. But here's what I'll offer. HIPAA fines, know what you can and cannot share. Make sure you have the right sign-off documents in your paperwork for your clients, right? It is worth go through the intake time, complete that admissions process, because HIPAA fines are hefty and impactful. Like a good set of HIPAA fines can close your business. So you want to be sure that you understand your requirements and you don't take them lightly. HIPAA covers protected health information, so names, addresses, that kind of thing, medical records, lab results, insurance and billing, all that important information, right? Any information that can be used to identify a patient. When you hire a contractor, your contractor must sign a business associates agreement, right? I know that a lot of PRPs, for better or worse, hire their rehab counselors as contractors. Well, your contractors are responsible for your data. Anybody, your biller, anybody who is looking in your files is responsible to the data that you are collecting and sharing, or your patient data. And so you need to be able to hold your contractors accountable, including your supervisors. So make sure that you are getting them to sign a business associates agreement. Have one on file that you have, that you keep for yourself. You're covered, make sure you know your covered entities. So even your volunteers, so any healthcare providers, any health plans, your clearinghouses, anybody you partner with that you're sharing data with, all of, you want to make sure that you understand their responsibility to HIPAA as well as yours. And then under that, like I said, making sure that any of your vendors, associates, volunteers, anybody who's touching your patient data is clear on HIPAA, but if they're a contractor, making sure that they have that business associates agreement in place. And then again, you know, we're all about sustaining businesses and making sure that you're able to remain functional and provide that good quality care. So being sure that you are following these HIPAA requirements is really kind of paramount. Last slide, Sugo, and maybe I'll just take questions after this because I think we've run out of time. So security risks and mitigation. So types of security, so digital security. So of course, making sure that your software and hardware are protected. A best practice, if you don't have in-house IT, hire, you know, use Geek Squad. Find, you know, use an IT contractor to help you. The data that you're using is important. Pay attention to your physical security. I know people have, like, you know, the plug-in drives and that hardware, software, your space. Pay attention to who has access to your space. Your major risks, any kind of IT, the major risk for infiltration is always the people. So leaving a laptop open, using a laptop at Panera Bread in full view of people, right? So even if you have an EMR, which generally are, you know, they're secure, but if you're using it in an insecure way, then you're opening yourself up to risk. Do the training. Don't just trust that you're, you know, you give them the Reliance training, your staff your Reliance training, and let them go about their business. In this area, do the training. Do the training around having access, sharing information, sharing passwords, all of that. It's there. Do the training. Financial lapses. So I know that a lot of small businesses, when you get started, the paperwork seems overwhelming. We always train on paper files before we move to an EMR, because if you don't know what's supposed to be in there when you go to purchase an EMR, they can sell you anything, right? And that's their job, right? To sell you something that you can grow into. The problem with that is, if by chance you lose access, you know, it's business, so you're taking a risk. If by chance you lose access, well, then you lose access to your patient files. So that severely limits your ability to conduct business, but then also protect your patients, your clients. So you want to consider all of these issues when you're trying to mitigate risk for protecting your data. So making sure that you have, if you bring in a good IT person, or if you get, you know, the Geek Squad, few points. Make sure you have some good policies and procedures in place for how people are supposed to use your data and your systems. Make sure that you have administrative controls on any kind of laptops or tablets that you send out into the community, or have at people's homes, or have in your office. Make sure that people are understanding that your documentation requirements and your training. Make sure that they undergo you undergo physical IT inspections, like looking at your cords, your computers, how you have, you know, how you have things set up, when your screens time out, that kind of thing. Make sure you include your data infrastructure and your ongoing monitoring. And then continuous improvement. Again, you always want to be getting better. Always, always, always. Right. And then just the bonus content. If it's not documented, it didn't happen. Key point, make sure you know the difference between your employees and your contractors. There's a certain level of, you know, you can't tell your contractors how to get the work done. So be careful who you hire as a contractor versus an employee. Invest in your training. And Suko can help with this part, or community lending can help with this part, but create a financial plan for yourself that's separate from your business. She is not your checkbook. She is her own separate entity. And so you really have to be mindful of that kind of stuff. Great resources. I promised I would, after I went through. I promised you I was going to go back and add this because these are great resources for your business. Use the tools that you have. Use the tools that are available in the city, either through Baltimore Community Lending or SBA. There are a million different resources that want to help you get started and be successful. And then, like I promised, Source of Truth slide, all these links are active and they have real information that you can use to make your organization great. And then that's me.
Thank you so much, Vanessa. I appreciate you. I know we're running short out of time, but it was a lot of information that was presented. So I always like to make sure that we get some questions going on. Vanessa is definitely an expert, as you guys just witnessed. I want to start off by the first question I see in the comment section. And if you have any comments, and I know some of you guys get a little shy, you feel free to just put it in the comments. First question is, who do you like best between CARF and GCO? And maybe if you could explain those acronyms, because I definitely don't know what those are. But who do you like best between those?
I think I meant to say JCO, not
Yeah, I know.
JCO.
So it depends. And I know that's a bad answer. Well, it's not a bad answer, but it's true. It depends. They both have certain flexibilities. So for instance, CARF is really I love the CARF manual. In fact, the work that I build whenever I work, I have an integrated set of policies and procedures that I use like as my baseline. And it really pulls the best out of both because essentially what they are giving you is industry best practices across the board. So if you are doing this thing as an industry, we understand that this is the best way to do it, right? And they update it year over year. In terms of like just operations, well, it depends because CARF, while they are more mentory, right, in their approach, they are stricter in time frames and how you add or change a service. Whereas Joint Commission is a little bit more flexible, right? They're more flexible in payment. They're more flexible in the time frame for coming out. Also, I guess a little bit of behind the scenes business in our state and trying to figure things out. Our state administration kind of said, well, we let CARF, we punted basically to CARF and they didn't, they just letting anybody do anything. And now look at us. Well, that's ridiculous. And CARF has said as much. And as you work with them, you see that they're even more kind of rigid in their approach to Maryland organizations until we get this stuff figured out. Yeah. So
That's
it
what I keep
depends on
hearing.
what
CARF is more difficult than JCO, and I see a lot of people switching over to JCO, but initially CARF was I didn't even know there were others. I thought it was only CARF for a little bit. So it's hard to I get why you're saying like it's difficult to tell. Do you think it's true that CARF is harder to get into, but easy to stay with, and then JCO is like the opposite? Like JCO's easy to get into, but they're hard to maintain.
No. I think so. The flip side of this is that I have seen a little bit of a difference in JCO's approach. And so like these organizations have personalities, right? Like so JCO started as a hospital safety organization essentially. And so their framework is really like that framework, but it's not as rigid as it used to be. And in fact, in September, the Joint Commission is they're doing a what do you call it? A conference where they're restructuring their process, right? And so I'm excited to see. I haven't gotten into all the details. They haven't really released enough for me to say like, oh, here's how it's going to be different. Or at least I haven't delved into that piece of it. But no, I think you can't really play that game with yourself, right? The one thing I try to get my clients to understand is that you are not really creating policies and procedures for the survey. You really are creating policies and procedures for the benefit of how you run your organization. And so that's why I like that aspire to excellence piece of it, because it really, like, you could take that and build any business. Honestly, like even when I'm doing my own work, I look to them, like the way I set up my budget, how they say like, oh, you do the annual projection and then you go back month after month and do the alignment. Like they really do give you a solid foundation for how you establish a business. But if you look in part 2, they're very flexible about what your services look like, whereas joint commission is a little more tight. So it just depends.
Gotcha. Thank you. I appreciate that. That was helpful.
Yeah.
Oh, good questions.
The next question is, what EMR system would you recommend? And if you could explain what EMR is as well, because I don't know.
EMR is electronic medical records. These are tough questions because the truth is, it depends. You have to adopt a system that works for your organization. For instance, if you have a smaller organization with a single program, you do not need an elaborate system that you don't know how to work and you can't download your information from. If you don't, yeah, that's what I, so like it depends on what you need, honestly, how savvy your clinicians are, right? And how you intend to use your EMR, right? So if you're a solitary agency and you're not really building out those connections, well, you don't need a lot of fancy, here's how I send, share information across. So the one thing I would say is you want an EMR that allows you to talk to other EMRs. That's a challenge.
Okay. So I have a question, and then I'll see if anybody else in the audience has a question. So, a lot of times when I deal with businesses within this industry, hiring is usually a thing, right? Because you can't do everything yourself, whether you want to hire someone to help you on the business side or you need help, right? If somebody's looking to get hired into this industry, like where would you suggest they go look for, or like where do you guys find talent at is really where I'm asking.
So first and foremost, we have two schools in the state that offer like the most common masters that you need, right? So there's Morgan State University, the national treasure, that offers the Masters of Social Work. And then there's the University of Maryland. So always tapping into those two schools is helpful. Also, Coppin has a program that is good and a good resource. Towson has nursing. Like there are. I would recommend starting at the universities, and from there, you just have to connect,
Network.
right? Yeah.
Got you. Okay. Any other questions? Maybe from the audience, anything that you guys want to ask, you can feel free to unmute yourself. Just want to open up the space for any other questions that we have.
This is Walter from Baltimore Community Lending. I work with Suko. I'm a loan officer here. Can you hear me?
Yes.
Walter?
Quick question. I know I have a couple of these healthcare organizations in my portfolio, and I know they changed the payee, the new vendor. Like, what is the lag time? So, like, I give the patient the therapy on Monday. When am I gonna get paid for that service?
So first you have to bill for it, right?
Oh, yeah, I understand that.
Yeah. And then I'm sorry, I didn't mean it like no offense. I'm sure
Oh, no.
but like first you got to bill for it, so that takes however long. But then once it goes through the process, I think they say they have 30 days, but it seems like it's taking more like 60, some 40, like more like it's feeling like you can bet on 60. So my recommendation to folks is, because I do have clients who they come to me, they're small businesses, right? So they're like, well, I didn't get paid, blah, blah, blah. And it's like, nobody wants to hear that. So my recommendation is always like, you have to have some bridge funding. They have to have bridge funding because it's so uncertain with payment right now.
So you
Yeah,
would recommend bridge funding of like 60 days to pay your staff, because or else, if I'm a W-2 worker, I'm gonna just leave. You're not paying me.
exactly.
Okay.
Yep. Yep. I would recommend 60 days. Also, like with anything else, the squeaky wheel gets the oil. So advocating for yourself, following up for your organization, having some dedicated staff that like stay on the process, that is always helpful as well. Also, medical documentation is paramount. I know insurance companies are there to pay you, but really, like they probably have some kind of small print that's like, we don't want to pay. So having your ducks in a row is very important. Like now more than ever, there's
Then
a formula to it, right?
Okay, and then the last question I have, I'm sorry. The last question I have is obviously, with all these changes with Medicare and Medicaid and, what will happen, after, certain changes are done, would you recommend a starting business to also diversify income streams of like private, I can take Medicare and Medicaid, but I can also take, I don't know, Blue Cross Blue Shield or whoever it is? Would you recommend having like those two systems, or
Yeah.
and which one pays more? I mean, like what, like, from, does Medicaid pay more for, let's just say, like a, I don't know, a 30-minute visit with the therapist, right? So like who pays more? Does Medicaid pay more, the clinician, or does, I don't know, Blue Cross pay more, or is it about the same?
So you asked two questions. The first one was, do you diversify payers? So yes, it's always good to have as many payer contracts as you can if if you provide a service that private payers actually pay for, right? So there aren't a lot of private payers that pay for services like PRP, but there are a lot of private, well, the most private payers and Medicare cover like therapy services, that kind of thing. So to the extent that you can, one, get credentialed not easily, but yes, you should be able to get credentialed, but keep in mind you need to manage the credentialing, and that's an additional cost, or like there's a different space like billing. There's a whole science to billing, and maintaining credentialing. So you want to make sure you have the capacity for that. Otherwise, it's just one other thing, because not only do you want to also have to build a patient, or you also have to build a patient panel around that, right? So it doesn't make sense to credential with Blue Cross, try to manage that line and make sure that you're following up and participating in that network if you're not like actively marketing to their, people with Blue Cross. So there's that. And then in terms of who pays more, if private payers pay for a service, in this space, Medicaid, in this space in Maryland, Medicaid is actually a decent payer, which is part of what we're seeing, right? Like why we have so many providers in this space, because Medicaid is actually a decent payer in this space. Generally, for most other services, Medicaid is not going to be your star payer. Yeah, but yeah, for this, Medicaid is a decent payer, and it's pretty, and by decent, we mean pretty on par with what other payers are paying.
Okay, thank you very much.
No, thank you for the question. Those are great questions.
Now
Um,
sorry, last question. To add to Walter's question, is there a way to find the Medicaid rate sheet on the state website?
Yeah, you can go to Carolyn. It might be, let me see. The link to, do I have the Carolyn link? If you go to Carolyn, you will be able to find the it's not, well, what, it's escaping me, but you'll be able to find the rate sheet on Carolyn's website.
I
I'm
think it's
sorry.
called the fee schedule.
That's the fee schedule. Yes.
Yeah,
yeah,
this is Walter. I can put my email address on there, and I do have that Medicaid payee sheet, for mostly like substance abuse and other things that I can send to anybody that wants it. If you email me, it's probably it's about a year to 2 years old, but it's a
Yeah.
good starting reference. I don't know how they change it, but I'll put my email in the chat, and if you want it, I'll just send it to you. Okay?
Hey, Walter, can I interject on that? Let me, because they have changed it.
Okay,
It does change every year. I
okay.
will, I'll
Or,
find it and, or I'll add it to my source of truth information,
okay,
and
no
that
problem.
way everybody will just have it as part of
Okay,
the slides.
no problem.
Yeah,
Okay.
Thank you.
yep.
We definitely got time. I think that
Hi.
there was a lot of information shared, so I definitely want to open up the space for more questions.
Oh,
I have a question.
hi.
Go
Sorry. Go
Oh,
ahead.
you
I'll
can go
wait.
ahead first. You go.
Okay. Yes, sorry. This is Ingrid. I have a question. I currently have a group practice and we provide services for private insurance. My question is, do you find or do you know based on your experience if it's easier to credential or move my already existing group practice into providing Medicaid, Medicare services, or becoming a community mental health based on the information you provided today?
So, oh, I'm so glad you have this question. A little bit of nerd fact. In previous iterations of the regulations, BHA actually proposed that organization. Now, this is previously is proposed, it hasn't happened, so just keep that in mind. Proposed that you actually would have to be a practice, like a group practice like yourself, for a year before you could transition into an OMHC. So you're definitely in a good spot, right? Because of the difficulty that folks have been having in getting through the licensing process, I actually have encouraged at least two of my clients to actually go the group practice route while they are pending their OMHC licensing. There's that. Because you are an OMHC, I'm sorry, because you are a group practice right now, really the leap to being an OMHC is not it's not a crazy leap, right? So you need certain staff for an OMHC, so you need to make sure you have a medical director who can be a psych nurse NP. You'll be a clinic, right? So then you have to have a psychiatrist who oversees, like any other clinic, right? Whether it's physical or mental health, you'll have to have a psychiatrist who oversees your clinic and actually does the what is it, that signs off on the medical necessity. There's been a whole lot of discussion on that right now. So you have to have those two additional positions. And then the other requirements are that you have to have and these are right now requirements, right? You have to have a multidisciplinary staff, two of which report to different licensing bodies. So, an LCSWC or an LCSW C and a marriage and family therapist. Now, that transition also comes with the cost of, accreditation, those additional licenses those additional staff that we talked about, and going through the licensing process. So, there's that. It's more administratively burdensome because, once you enter into that accreditation space, then you are looking at a whole lot of policies and procedures that you don't necessarily have in the practice setting. But my question is, where are you, and would you be offering substance use disorder services?
No, and the second one, unless I would have a specialist on that. Right now, I don't. And the other one is I am in Montgomery County, actually. And so I don't know how much of this is applicable. I hear you referring a lot to Baltimore County.
You said you're in what county?
Montgomery County.
Yeah. So everything we're talking about is Maryland statewide.
Okay.
Right?
I'm in Germantown specifically.
Okay. So if you want to talk more about this, we can. But Montgomery County is one of the counties that has a moratorium right now. So the benefit of transitioning to an OMHC, like, yes, you can get the higher rate, but you have to have more staff. And the real draw had been that you could offer those higher level SUD services, like you could offer IOP, you could offer a PHP, and really build out your service program in that way. But being that there's a moratorium and you don't want to expand, I don't know that the juice is worth the squeeze. But
No.
we could do, if you want to talk about it, we could do some financial modeling and figure it out together.
I appreciate that. That's actually very, very helpful. Yeah, so I'll have the information and connect with you, because yeah, and you provided a lot of good information that will definitely help me determine whether I move, I'm engaged in this long process or continue the way I am right now.
Sure. Yep.
Thank
I'd
you
be
so
happy
much.
to talk you through it. Yep.
Appreciate that.
So I'm gonna give more time for questions. I just want to make sure I get a couple pieces of information out. So Vanessa's presentation was super detailed and a whole lot of information. So I will definitely be including that in the resource guide. I've seen a lot of the links on there. So that would definitely be posted. The recording of this is going to be on our YouTube link, and I'll probably put this specific one here on the resource guide as well. But I just wanted to ask everyone here, what else would be a resource for you guys as far as like what information? I know on our end, we deal more so on the business development and the funding side of things, but just wondering like what other sources of what other resources would make sense.
Maybe the credentialing piece for Medicaid, Medicare at the state level, so that way we have understanding on the steps and what it takes to get a credit, well, get the necessary MPI or credentialing with those bodies.
Okay, I got you. Okay. And then I don't know if there's anyone else that wants to speak as far as resources.
One thing I had trouble with when I was starting up was locating information on like the office requirements. I wasn't sure how big or small office I would need.
Mm-hmm.
So Neil,
Got
yep, that's one of those things. And not only I can add like 5 things to your list. Big or small, can it be in a space with other organizations? Do you need sprinklers? All, yep, definitely a good space. Yep.
Okay.
I have a question. Are there do you help with, I guess, individual clinicians? And because I know you mentioned hiring and making sure you appeal to your staff, which are usually, top heavy with clinicians. Do you offer resources to the clinicians, like, in terms of like making sure they're protecting their license and things of that nature?
Yes. So we do. Not only do we help, so I'm an educator by nature, if you didn't know, if you couldn't tell. But yeah, like we do education along the gambit, because we really want solid services for folks. And it's difficult to find a therapist. And so or difficult to find help. So when we have organizations that are there to help people, we try to keep everybody in good shape. Right before we had this call, I was on the phone with a biller saying like, hey, as a biller, you have certain responsibilities and da 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 da. And you need it. So yes, we definitely do. We check licenses, we inform people about like, what it looks like to be on the exclusions list and which, how you protect yourself that way. And we do a lot of consultation about protecting clinicians within an organization. So not just like, hey, you're a mandated reporter, or you want to this is how you move in certain ways, but also if something is not happening right, like we need to deal with it because X, Y, and Z is happening under your license, right? So what does that look like for you?
On your website, do you offer like one-on-one consultations or meetings or?
Oh yeah, yep, we do. So when we started, so I come to this work. I was a long time policy person working in financial management for Medicaid. Then I worked in Medicare, and then I worked in the duals office. And when I shifted to this work, it really was on a favor, right? A friend said like, "Oh, can you help me do this?" And then I got into the space and was just kind of like, there's some work to be done here. And so this is where our heart is, right? So the other areas are kind of like we like doing that too, but this really is the intersection of where our heart is. So we definitely do consultations, and what we like to bring our clients along so that we offer what we call fractional compliance. So oftentimes smaller organizations can't afford like a full-time compliance officer. So what we do is we have a compliance plan, we tailor it to the organization, and then we assign you a compliance officer who works with you for a certain amount of hours in a month to run through your compliance plan, which is helpful because like I have one client who is she's a clinician, and she's not paying attention to how many meetings, like she's not paying attention to her uh X, Y, and Z,
Yeah,
but we
I
can,
agree.
right?
Same
But
boat.
yeah, we do all, I mean, we really are a partner, right? So we come to help. So if you have a compliance officer and you need help, we can help your compliance officer. You need tools, we can help you with tools. You need an assessment to see where you can be stronger, we do that. And so we offer, like, we can work on a retainer, where we meet one-on-one, or we can just do an hourly, let's have a conversation kind of thing.
Mhm.
Awesome. Thank you so much.
Sure.
I just wanted to add this in too. So I've spoken to Saida, who's on this call, by the way, and I just heard that this industry, there's just like a lot of silos as far as where the resources are and who to talk to, and there's just variations of what people are doing. It doesn't really sound like there's a hub of information and people to talk to. So I mean, I'm not opposed to planting the seed to start something here, but a question for you, Vanessa, where did you go to get all this information? Like, what are the organizations that you go to? Maybe you can share it and everyone can kind of follow. But yeah, just want to ask that.
So she's absolutely right. There is no hub. And so we work statewide, right? And we are
Yeah.
broadening to work outside of the state. One of the things that we have been thinking about is how do we bring all that together? Part of how we envisioned even our website was to be a place where you could come and get real information, right? Because
Mhm.
there are silos, and honest to goodness, we just search for the information, right? The key
Mhm.
is in knowing where to look. So that's why I'm always on the source of truth information, and I have a library of these links where people go to find information, because we do operate in silos, information is inconsistent, and there's this network, right? So there's a network of, well, this is how you do it. But if everybody has been like a little bit off kilter in how we get it done, then we just sharing bad information. And so
Mhm.
the best I have right now is coming together around source of truth information. There
Mhm.
there are some organizations uh that, like, association type organizations.
Mhm.
I find that smaller organizations are a little bit shy of those organizations because they do cater to the largest. And it's just a different industry if you're small versus large, right?
Mhm.
Um, and so there's definitely space for creating like a hub of information. I think there's a need. We actually have a provider curriculum that
Mhm.
we share with our providers. We teach
Mhm.
classes, but we have a provider curriculum that tries to get the information out, shares, like, helps people build their source of truth information
Yeah.
library and stuff like that.
No, that's amazing. Uh, I would definitely include Vanessa's website link on here, just so everyone can follow. I guess the last question that I have, and then I'll open up the space for anyone else that has any other questions. The business that you guys are in, it's done a lot of like virtual. I think after COVID, like your business model changed drastically. So with that being said, how I don't necessarily know if expansion is the word, but how do you guys offer services in different locations, like in different states, while still like being in compliance? Like how does that work? That's just something I think about.
You mean like the behavioral health space or me?
Yeah.
Okay, so behavior.
Uh,
Yeah.
Behavioral health space, like just for the audience, like if I'm in Maryland and I have a business, but I'm looking to offer my services in different states. Like, how does that compliance and everything that you spoke about, how does that change and how can they navigate that?
Yeah, so one, rules around telehealth. We had like pre-public health emergency telehealth where people were kind of skittish. Then we had post, like during public health emergency where it was like get it, get in where you can fit in. And
Hmm.
then we had kind of a dialing back. And I think what we see now is more of a like, wait a minute. We knew that we could get services to individuals using telehealth in an effective manner, and we knew that it supported us well. How do we keep that going? So that's where we are now, with some like considering the restrictions, but still being very flexible. Okay.
Hmm.
In terms of operating across state lines, it depends on the nature, like the type of business you have. So for instance, um, Ingrid's business, she's a group practice. If Ingrid as a clinician can be licensed in Pennsylvania and North Carolina and Virginia, if she can get parity for her license, which means if her license in Maryland somehow can be translated over to another state, or if she can be licensed in another state, then she can
Hmm.
operate in accordance with that state's laws for where a clinician has to be in terms of like how they have to be licensed and where. Um,
Hmm.
Public behavioral health systems are different across states. Medicaid, right, is different across states. There's a Medicaid joke that's like, if you've seen one Medicaid program, you've seen one Medicaid program. And it's absolutely true. So you can have a business, you can have a PRP here in Maryland, and it can be called a PRP, and you operate it a certain way. In Virginia, it might be called something else, and they may not pay for it in a certain way. You might have to do something different. So really, understanding the state you're going into, or the geographic location you're going into, and just making sure that you are adjusting to meet the laws of whatever state you're operating in is key, right? So
Hmm.
knowing where you're going, knowing what the requirements are, and meeting those requirements. One strategy, though, is using the foundation of your accreditation, because some states don't even require accreditation. Like Maryland is an accreditation-based license for community-based mental health services, but other states don't have that same requirement. So using your accreditation, so you're here in Maryland, you have this extra process, like, okay, how do I use what I have here in Maryland and translate that into services in Virginia, right? It's a sound business model. So I don't need to throw away the baby with the bathwater. I just need to massage it a little bit, and now it's Virginia, right? That kind of thing. But I will say, like, as you consider expansion that way, um, make sure you are looking at like uh what the presence requirements are, right? Like, do I need to have a physical location? Is this the kind of place where I need to have, do I know anything about this space? Heck,
Hmm.
even in Maryland, there are opportunities opening up in some of the more rural areas, and you hear people like saying like, oh, well, I can go to Westchester County and open X, Y, and Z. But do you really, some of these counties, you got to bring your own resources. It's different. Now, Baltimore City, there's less opportunity for partnership if there's no real infrastructure there. So those same kind of considerations for
Yeah.
expanding.
Yeah. No, that's a great explanation. I don't see any other questions, but I always like to open up the floor because I know we do have loan officers and myself that work with a BCL. So I don't know if anyone has questions as far as funding related, or business related or anything like that, I feel like that's also important too because you need the money to start, and you need the information on how to operate your business. So just want to open up that space as well.
Yeah, quick question. We formed a nonprofit here in Baltimore called Tranquil Essence, and it's pretty much more of a holistic side of practice when it comes to integrating into the treatment plan. But we are looking to acquire space, and we're actually doing a capital campaign now and trying to create an infrastructure or ecosystem in a sense where we can provide housing along with the actual community-based support or therapy within one location. So trying to figure out how to really get into the acquisition part of it in terms of, purchasing a building,
Mhm,
how you all can serve as a resource to that and what that process would look like, or how, I guess next steps for us would be to try to, I don't know, even come on site to talk with a
mhm,
representative to just create a
mhm.
map in a sense.
Yeah, that's a great question. I'll start off by saying that on BCL's part, when you s- when once it's on the real estate side, because we have two different departments, small business and real estate. Now, on to my knowledge, on the small business side, we don't offer financing currently to nonprofits. I know of we are in conversation of providing resources for them, but not currently right now. So what I can do, I'm going to put my email address on here, and I'm going to get you in contact with someone on the real estate side, only because their process is definitely different. So what I'm saying is if you're thinking as to purchase a building, BCL wise, we wouldn't be able to provide you financing since your entity is a nonprofit. Now I'm more than happy to have a conversation and finding different resources for you as far as actually making the purchase. That is something that I really focus on. I just had a conversation with someone who works at Downtown Partnership, and they have an array and plethora of different resources, especially in Baltimore City. So more than happy to have a more in-depth conversation with you. So I'm gonna put my email address in there. You can reach out to me and we could take the next steps.
Sounds good. Thank you.
No problem.
Hey, I just wanted to offer really quickly, always in the nonprofit space, you wanna, grants, of course, you're gonna be reaching out to the grants, but make sure you are looking to diversify. So especially in the nonprofit space, look to diversify that funding, look at ways, because oftentimes, grant funding priorities shifts. You don't always want to be in a position of like chasing or making sure that your grant funding is secure. It's hard enough as it is, but always look to different payers, look for diversified grant opportunities, like there's like different what do you call them, models that they put out, that like SAMHSA, HRSA puts out different models. Just be creative, because grant funding can get interesting, and I want you to be able to always have a pulse on a strategy for making sure you can stay funded that way.
Right. Thank you again.
Yeah.
Appreciate it.
Any other questions? I see Danelle Pinder has her hand raised up, so you
Yes,
can go ahead.
hello. Hello, thank you. So I have a similar question as the gentleman, and I'm gonna be in touch. I wrote down both of you guys' emails. So
Mhm.
I have a nonprofit as well, but I also have an LLC. A nonprofit is Excellence and Ambition, and we support
Mhm.
youth in workforce development and entrepreneurship. And
Mhm.
my for-profit venture is the same, but I want to similar get into the real estate side and thinking of opening a group home. We have young people that have been a part of our program historically that were in group homes, and I think it would be a
Yeah.
good combination to do both. And so I definitely, and what you just said about grants, we just found out we were a year-round youth work site with MOED, and we just found out that
Mhm.
we're not going to be a year-round youth work site due to budget cuts. We also are a funder. We funded with a lot of different local nonprofits, but we just found out that West Baltimore Foundation won't be supporting us for next summer
Oh wow.
because of a federal cut. And
Mhm.
so it's like, oh my God, how can we pivot And so I
Mhm.
really feel like I need to get with you guys to discuss how to
Mhm.
maneuver in opening this space,
Mhm.
so that we're prepared for the pivot.
Yeah, no, that's a great question. More than happy to have the conversation because as I mentioned, just hearing from BCL side, we have been hearing that the nonprofit space is currently in need of a lot of funding. And we're trying to figure out something to help because currently right now we only focus on four businesses, but because of our mission and the federal cuts and everything that's going on, like it is definitely a need. So I'll do my best to get you in conversations with our operations team because I think they're really involved in that. And we hired because we have like a small business development center that we just started. We also have someone who we've hired to kind of be like an investor relations to find funding for us. And I know that we have a nonprofit entity, so more than happy to get you in conversation with her, just to see like what are the resources are, and just go from there. So
Thank you.
send me an email, and I could definitely contact you for sure.
Thanks so much.
Mhm. Any other questions for us, whether it's business related, um, anything with the presentation? More than happy to answer.
Hey, can I just real quick before we hang up, I just want to thank everyone for being like giving me this opportunity. I really do believe in like divine ordering. So I really think anybody
Yeah.
who's here was supposed to be here. So thank you so much for listening to me. Let me nerd out on this. Sugo knows that I could be like, I know when I'm talking to him, he's like, is she ever gonna shut up? But probably not. I didn't even get on my community spiel about how this work is so important. But like,
Yeah.
thank you so much for listening and I'm
Mhm.
here to help. I really am a partner. Reach out.
Mhm.
I'm happy to have a conversation.
I appreciate you. And yes, Vanessa is for sure an expert. You could see the passion and you could definitely hear the passion. So I want to highlight that all of this will be recorded. I just need a little bit of time, put everything together, make sure all the details is right. But everyone who registered will definitely be getting this. You'll be getting Initiate Prosperity link. You'll be getting the presentation. You'll be getting some of the links that Walter had mentioned. I'll contact him and put that together. But I want to also thank you guys for showing up. Putting things like this is not necessarily easy, especially since it's so industry focused. But I think it highlights that there's a need for more resources for your industry. So thank you guys for showing up. And the last thing that I would add is BCL, we have a small business development center. So I think it's worth it just to stop by and kind of see what's going on. And the reason why I say that is it's not just what we have going on. We have the SBA going on. For example, we have for businesses who qualify, we have a free session with lawyers, right? And that's something that I'm in the process of emailing out. Like, there's just sometimes I'm just like, oh man, I should send this to here. Like, there's just so much going on. I really do feel like it's worth it just to get as close as possible, whether you want to stop by or you want to reach out to me. There's too much information happening that I feel like you guys are missing out on. So definitely want to highlight that. But it was a pleasure seeing everyone. I hope everyone enjoys the rest of their day. If there's no other questions, I'd like to end the session. Oh, all right, everyone. So enjoy the rest of your day, okay?
Have a good one.
All right, take care.